Has your dog ever had, a patch of hair loss that just seemed to appear? Or maybe some skin that just won't stop itching?
It's definitely something that makes pet owners worry.
For sure. So today, we're doing a deep dive into something that could be behind those mysterious skin issues in our dogs. And sometimes, though it's rarer, in cats too. It's called demodecosis.
That's right. And think of this deep dive as, well, kind of a shortcut to understanding it. Demodecosis is basically an inflammatory skin condition. It's caused by an increase in these tiny mites.
Okay.
And our goal today, using the material you sent over, is really to get to grips with this condition, but, without getting totally bogged down in the super technical stuff.
Exactly. We want to figure out what's really going on, not just the surface symptoms, the skin stuff, but like the underlying causes.
Yeah, where it happens.
And the different ways it can show up and what it all means for keeping our pets healthy. So let's start with the basics. What exactly is demodecosis?
So, in really simple terms, it's when these microscopic mites, which interestingly normally live on your pet's skin anyway, just in small numbers, they start to multiply way too much, and that causes inflammation.
Okay.
The more formal definition, it's an inflammatory parasitic disease. You see way more Demodex mites than normal in the hair follicles and just on the skin surface, the epidermis.
And I'll use it to other issues.
Yeah, that overgrowth can cause secondary problems like infections getting into those hair follicles. And importantly, it tends to show up in two main forms.
Which are?
Localized, meaning it's just affecting a small area, maybe one or two spots. Or generalized, which means it's much more spread out over the body.
Localized and generalized.
Got it.
So let's zoom in on dogs first. What's the deal with these mites in dogs specifically?
Okay, so in dogs, we mainly talk about three types of Demodex mites. The most common one is Demodex canis.
The canis, okay.
Now, here's the thing. These little guys are often just part of the normal scenery on a dog's skin.
But they're supposed to be there.
In small numbers, yeah. Think of them as tiny residents, usually harmless, living down in the hair follicles and the oil glands, the sebaceous glands.
Yeah.
And they get passed from the mother dog to her puppies really early on, like in the first 2 or 3 days of nursing.
Wow, okay.
So usually if the numbers stay low, absolutely no problem.
Right, so Demodex canis is usually fine. What about the other two you mentioned?
The second one is Demodex ingi. This one's a bit different. It's larger, kind of long-bodied compared to D. canis.
Bigger mite.
Yeah. And it lives in what's called the pilosebaceous unit. That's the hair follicle plus its oil gland. We actually don't know for sure how D and J gets transmitted.
Oh, interesting.
And another key thing is that we mainly see it causing disease in adult dogs. And it seems to have a higher incidence in certain terrier breeds.
Like which ones?
West Highland white terriers, wire-haired fox terriers. Often you'll see the problems along their back, the dorsal midline. So it's got these unique features: size, location, and that breed link.
Okay, Westies and Fox Terriers for D and J.
Okay.
And the third type?
That would be Demodex corneae. This one lives right up on the surface in the very top layer of skin, the stratum corneum.
On the surface, not down in the follicle.
Exactly. And again, we're not totally sure how it's passed along. Some researchers even think it might just be like a variant of D. canis, maybe just adapted slightly differently.
So three types, D. canis being the usual suspect and normally okay in low numbers. What causes the population to just, boom, explode and cause problems?
Right. The trouble really kicks off when the dog's immune system, which is normally the peacekeeper keeping those mite numbers down, kind of falters. It can't do its job properly.
The immune system slips up.
Yeah. And this mite overgrowth can lead to something called immunologic exhaustion. You can picture it like the immune system gets so swamped by the sheer number of mites, it just sort of gives up trying to control them.
Well,
and the initial trigger for this might be genetic, something inherited, or maybe some other underlying issue weakening the immune system. So often it's not the mites themselves being suddenly aggressive, it's more about a weakness in the dog's defenses letting them get out of hand.
and the main target is the skin system, right? The skin and related structures.
Exactly. Primarily the skin and the exocrine system, like those oil and sweat glands we mentioned. And like we said, a dog's genetics seem to be pretty important, especially maybe for why some dogs are more susceptible to that initial mite increase.
You mentioned it's common in dogs, less so in cats. Are there specific dog breeds that are like predisposed to getting demodecosis, particularly the D. canis type?
Yes, definitely. For D. canis, certain breeds seem to pop up more often. Think American Staffordshire Terriers, Shar-Pei's, Boston Terriers, English Bulldogs. and also West Highland white carriers again.
Okay, quite a few there.
And for D&J, like we noted, the Westies and wire-haired fox terriers, but also Shih Tzus seem to be more commonly affected.
Gotcha. And when does this usually show up? Is it a puppy thing, an older dog thing, or?
The age can actually give us some clues. That localized form, the one with just a few spots, that usually appears in dogs younger than a year old.
Young dogs.
Yeah, typically the median age is around 3 to 6 months. But the generalized form, the more widespread one, that can pop up in both young dogs and older adult dogs.
Okay, that paints a good picture for dogs. Now let's talk symptoms. What might you actually see if your dog has this?
Well, with that localized juvenile onset form, the one in young dogs with just a few spots, the signs are usually pretty mild.
Like what?
You might notice a bit of redness, what vets call erythema, and maybe some light flakiness or scaling on the skin. These often show up as small, distinct patches.
Whereabouts, typically?
Most often on the face, think around the mouth and eyes and on the front legs, sometimes on the body and back legs too. But the key thing is, these localized patches often look quite minor, not too dramatic.
Okay. But what about the generalized form, the more serious one?
Right. Generalized demodecosis, whether it starts young or in adulthood, tends to look more severe right from the get-go. You'll see multiple patches of redness, but they're often poorly defined, kind of blending into each other.
And hair loss.
Definitely. Hair loss, alopecia, and more noticeable scaling. And here's what it can get nasty. Because those hair follicles get stuffed full of mites, they can rupture.
Oh, wow.
Yeah, that condition is called furunculosis.
Mm.
When the follicles rupture, it often leads to secondary bacterial infections setting in.
So it gets infected.
Exactly. And then the skin can become really inflamed. It might ooze, and you can get these firm raised bumps called granulomas, which are basically signs of chronic deep inflammation. It can look pretty bad.
That sounds awful.
Yeah.
And you mentioned Demodex NGI, the larger mite, has its own specific signs sometimes?
Yes, dogs with DNG often get this greasy type of skin inflammation called seborrheic dermatitis, especially along their back.
Greasy skin?
Yeah. And you might also see blackheads, commonones, plus the redness, hair loss, and sometimes hyperpigmentation, which is where the skin turns darker in those areas.
And is there also a form that just hits the paws?
There is, yes. Pododemodecosis. Podo meaning foot. This can happen even if the dog doesn't have generalized lesions elsewhere.
Just the feet.
Right. And it often gets complicated by secondary bacterial infections, sometimes quite deep, making the paws really painful and swollen.
Okay, so quite a range in dogs from a few mild spots to really severe widespread issues. Let's switch gears to cats now. You said it's less common in cats.
That's right. We definitely see Demodecosis less often in cats, and honestly, we still have more to learn about it in felines compared to dogs.
Okay.
What we do know is that the mites can be found on their skin surface and also inside their ear canals.
Same mites as dogs or different ones?
Different ones, mainly. We've identified 2 main species in cats, plus there's mention of a third, unnamed one reported. The first is Demodectic gatoi. This one's really interesting because it seems like it can be contagious between cats.
Contagious, unlike the dog ones usually.
Exactly, that's a big difference. And D. gatoi is often linked to itchy skin disease, dermatitis. So that potential for spreading is key, especially if you have multiple cats.
Definitely need to know that if you have a multi-cat household. What's the other main cat species?
The other one is Demodex cati. Now, infections with this mite often signal something else might be going on.
Like an underlying issue.
Precisely. It's frequently associated with conditions that suppress the cat's immune system or affect their metabolism. So finding D. cati often makes vets dig deeper to look for other health problems.
Are certain cat breeds more likely to get it?
Well, there's some suggestion, maybe a slightly higher incidence in Siamese and Burmese cats, but we probably need more solid research to be sure about that.
And what signs would you see in a cat with Demodecosis?
It can vary, but you often see patchy hair loss, sometimes completely bald spots in multiple areas.
Thereabouts on the cat.
Common spots are eyelids, around the eyes, the head, neck, along their sides, and on the belly. The skin itself can be itchy, sometimes very itchy, especially with D. gatoi.
Right, the contagious one.
Yeah, and you might see redness, scaling, maybe some crusting. Remember, D. gatoi lesions are often super itchy and potentially spreadable to housemates.
Okay.
We've also seen ear infections reported, specifically a waxy inflammation called ceruminous otitis externa. And again, if it's D. cati, that's often a red flag for some other underlying health concern.
So different mites, different implications for dogs versus cats. Let's dig into the why a bit more. What actually causes this mite overgrowth and who's most at risk?
Well, the direct cause is the mites themselves, right? The
Yeah.
specific species, D. canis ingicornae in dogs, D. cati and gatoi in cats.
Right.
But when we look at the risk factors, especially in dogs, it gets more complex. We don't fully understand all the immune details, but studies suggest dogs with the generalized form might have, let's say, inefficiencies in their immune cell functions,
How so?
like maybe problems with how immune cells talk to each other, the signals they use, or the cells themselves aren't responding quite right. Think of it as their defense team not being perfectly coordinated or equipped.
So it really comes back to some kind of immune system weakness or imbalance.
That seems to be the core idea, yeah.
Yeah.
And we also know genetics play a big part, particularly in those localized cases in young dogs. Plus, any other condition that suppresses the immune system, maybe certain medications or other diseases or affects the body's metabolism, can also predispose a dog.
Makes sense. And what about risk factors in cats?
For cats with D. gatoi, the one often linked to other issues, the connection is quite strong with things like FIV, feline immunodeficiency virus, which hits the immune system, or SLE, systemic lupus erythematosus, which is an autoimmune disease, and even diabetes.
So finding D. cati really means looking for those things.
Absolutely. But D. gatoi, the short, stubby, potentially contagious one, seems different. It doesn't appear to be as strongly linked to underlying disease, and as we stressed, it can spread between cats living together.
Okay, so understanding those potential underlying causes is super important. Now, if you suspect your dog or cat has this, how does a vet actually diagnose it? And crucially, what else could it look like? Because skin issues can look so similar sometimes.
That's a really key question. Because yes, several other skin problems can mimic demodecosis. In dogs, the vet needs to consider things like bacterial folliculitis or the deeper furunculosis.
The infections we mentioned.
Right. Also ringworm, which is actually a fungus, not a worm.
Confusing name.
It is. Then there's contact dermatitis, which is a reaction to something touching the skin. Pemphigus complex, an autoimmune skin disease.
Yeah.
Dermatomyositis, which affects skin and muscle. Even systemic lupus.
Wow, that's a long list.
It really highlights why you need proper workup by a vet, doesn't it? You can't just guess based on looking.
Absolutely. What about in cats? What are the lookalikes there?
In cats, the possibilities include allergic dermatitis, skin inflammation from allergies, infestation with notoadris, which is another mite that causes intense itching,
Yeah.
sometimes called feline scabies. Ringworm, again, is on the list for cats, too. And interestingly, sometimes what looks like a skin disease is actually psychogenic or behavioral dermatitis.
Meaning the cat is causing it themselves.
Yeah, like over-grooming due to stress or anxiety leading to hair loss and skin irritation.
So how do vets sort through all this? What tests do they usually run?
Well, standard blood work, like a CBC, blood chemistry urinalysis, is often normal if it's just demodecosis without complications or underlying disease.
But they might do them anyway.
Oh, yes, because they can help uncover those underlying issues that might be contributing, especially in adult onset cases or with D. cati in cats.
Right.
In cats, vets might also suggest tests for RV and FIV feline leukemia and immunodeficiency viruses, or maybe toxoplasmosis titers. And believe it or not, very rarely you might find mites in a fecal sample if the animal swallowed them while grooming.
Huh. But the main diagnostic tool is looking directly at the skin, isn't it?
Absolutely. Skin scrapings are the go-to method.
How does that work?
The vet uses a blade, often dulled slightly, or a spatula to gently scrape the surface layers of the affected skin. They might need to squeeze the skin fold first to push mites out of the follicles.
Okay.
Then they put that collected material, skin cells, debris, hopefully mites, on a slide with some mineral oil and look at it under the microscope. Usually that finds the mites if they're there in significant numbers.
Are there other ways besides scraping?
Yes, another useful technique is a trichogram.
Tricho what?
Trichogram. Tricho meaning hair. The vet plucks some hairs from the affected area, mounts them on a slide, and examines them microscopically. Mites clinging to the hair roots can sometimes be seen this way.
Oh, okay.
And in some tricky cases, especially with chronic thickened skin, like on the paws with Demodecosis, a skin biopsy might be necessary.
Taking a small skin sample.
Exactly. A small piece of skin is surgically removed and sent to a pathologist who can examine the tissue structure and look for mites within the follicles or skin layers. That gives a very definitive answer.
Okay, so let's say the diagnosis is confirmed, Demodecosis.
Right.
What happens next? What are the treatment options?
Right, treatment. The good news is most cases can be handled as an outpatient, meaning the pet doesn't need to be hospitalized.
That's good.
And it's really important to remember, especially for dogs with that localized form, maybe just one or two patches, a very high percentage, like maybe up to 90%, actually resolve on their own, spontaneously.
Without any treatment.
Often, yes.
Hmm.
But it's still crucial for a vet to check them out, assess their overall health, whether it's localized or generalized. You want to make sure nothing else is going on.
Makes sense. And what should owners know about the treatment journey?
Client education is super important here. For those mild, localized dog cases, hearing they often clear up on their own can be very reassuring.
Yeah.
But for generalized demodecosis, owners need to understand it can be, well, a bit of a marathon, not a sprint. It can be chronic, potentially costly, and frankly, frustrating sometimes.
Because it can't come back.
It can, or it might take a long time to get under control. Now, the generalized cases that start in young dogs often have a good prognosis for successful treatment, but the ones that develop in adult dogs, those are often more about management than a complete cure because there's usually an underlying issue.
Oh.
And a really critical point, especially for juvenile onset generalized cases, since there's thought to be a genetic link, breeding affected dogs is strongly discouraged.
Right. You wouldn't want to pass that predisposition on. That's vital advice. So let's talk medications. What are the main things vets use?
For dogs, a common first choice is often amitraz.
Amitraz. Okay.
It's a type of drug called a formamidine. It basically messes with the mite's nervous system. It's usually applied as a dip or rinse.
A dip? Like bathing the dog in it?
Pretty much, yeah. Typically done weekly or every other week.
Yeah.
You continue until the skin looks normal and you get negative skin scrapings, no mites found.
And then you stop.
Not quite. You
Right.
usually continue treatment for at least one more month after the first negative scraping, just to be sure.
Okay. Any prep needed?
Clipping the dog's hair, especially if it's long, can help the dip penetrate. And using a specific type of shampoo first, like one with benzoyl peroxide, can help flush out the follicles and kill surface bacteria.
Good tips.
And you don't rinse the amitraz off, you let it air dry. How well it works can depend on the frequency and the concentration used. Interestingly, it's sometimes used off-label, very carefully, and at low doses in cats, but caution is needed, particularly in diabetic cats.
Okay. What if amitraz doesn't work or isn't suitable? Are there other options for dogs?
Oh, yes. Another major player is ivermectin.
I hear that name a lot for parasite control.
Right. It's in a class called macrocyclic lactones. It can be very effective, even when amitraz hasn't done the trick. It's usually given orally, by mouth, every day.
Daily pill.
Yes. Now, a really important point with ivermectin. Some dog breeds have a genetic sensitivity to it.
Which breeds?
Primarily herding breeds, collies, shelties, Old English sheepdogs, Australian shepherds, and their mixes.
Right. The MDR1 gene issue.
Exactly. So it's absolutely critical to start with a very low test dose under close vet supervision to watch for any adverse reactions before going to the full therapeutic dose.
That sounds crucial. How long is the treatment?
It usually goes for quite a while, typically 30 to 60 days beyond achieving negative skin scrapings. The total duration can average anywhere from 3 to 8 months.
Wow, that's a commitment.
It is. And like amitraz, ivermectin use for Demodex is technically off-label in dogs and cats, meaning it's not specifically FDA approved for this purpose, but it's a common and accepted veterinary practice. It's also been used off-label in cats, though dosage isn't as standardized.
Okay. What about milbemycin? That's also in some preventatives.
Melamine oxime, yes. Another macrocyclic lactone works similarly to ivermectin. Studies show it can cure a good percentage of canine Demodex cases when given orally each day.
So why isn't it used more?
The main hurdles are cost. It can be quite expensive, and availability in the U.S. for this specific use. So again, it's considered off-label. Interestingly, those ivermectin-sensitive breeds often seem to tolerate milbemycin better at the doses needed.
Good to know. Any other drug options for dogs that people might hear about?
There are some anecdotal reports, meaning based on case experiences rather than large studies, about using moxidectin and doramectin.
Also macrocyclic lactones?
Yeah. They've been used topically, like spot-ons, or sometimes orally, but oral use is generally discouraged in those ivermectin-sensitive breeds due to similar potential risks. Again, considered off-label.
Okay, so several options for dogs requires careful vet guidance. What about cats? You mentioned amitraz isn't common. What is used?
For cats, treatment isn't quite as clear-cut sometimes, but a very common and often effective approach is using topical lime sulfur dips.
Lime sulfur. Sounds old school.
It is a bit, but it works. Usually done every 3 to 7 days for maybe 4 to 8 treatments total. It's often a recommended therapy, especially maybe for gatoi.
Okay. What about the oral meds like ivermectin or milbemycin for cats?
Studies are more limited in cats, but there are anecdotal reports suggesting they can be effective. Dosages and protocols aren't as well established as in dogs. Dormectin, dipped as a weekly injection under the skin, has also been reported as effective in some cases.
So fewer large studies, more case-by-case basis for cats.
Often, yes, especially for the systemic treatments.
You mentioned the breed sensitivity for ivermectin in dogs. Are there other absolute don'ts or contraindications?
The big one is definitely ivermectin in those susceptible herding breeds due to that MDR1 gene mutation. They lack a protein that normally keeps the drug out of the brain so it can build up to toxic levels.
And milbemycin is generally safer in those breeds.
At the doses typically used for mite treatment, yes, they seem to tolerate it much better.
Good distinction. What about potential side effects owners should watch for with any of these treatments?
Okay, with amitraz dips in dogs, you might see things like drowsiness, lethargy, maybe they seem a bit depressed or lose their appetite for about 24 hours after the dip. That's relatively common.
Anything more serious?
Less commonly, yes, more severe side effects like low heart rate, low body temperature, or high blood sugar can occur. And people doing the dipping need to be careful to wear gloves, ensure good ventilation as it can cause skin irritation or headaches in humans. There is an antidote, yohimbine, if a dog has a bad reaction.
Okay. What about ivermectin or milbemycin side effects?
Signs of toxicity, especially if the dose is too high or in a sensitive dog, can include excessive drooling, vomiting, dilated pupils, acting confused or disoriented.
Neurological signs.
Yes, in more severe cases, tremors, blindness, seizures, coma, it's serious. Hence the extreme caution needed with dosage and breed sensitivity, particularly for ivermectin.
Definitely underscores the need for vet supervision. Are there
That's-
drug interactions to worry about, like if the pet is on other medications?
Yes, definitely. Amitraz can interact with certain antidepressants, like SSRIs or MAOIs, and also sedatives like xylazine or benzodiazepines.
Right.
Ivermectin and milbemycin can potentially interact with amitraz and benzodiazepines too, possibly increasing sedation. And a very specific one. The flea control product Spinosad, found in some popular flea pills, should not be given concurrently with high-dose ivermectin therapy due to increased risk of neurological side effects.
Wow, lots to consider there. So once treatment starts, how do things progress? How does the vet monitor, and what are the long-term considerations?
Monitoring is key. The vet will want to see the pet back regularly. They'll do repeat skin scrapings or maybe hair plucks to see if the mite numbers are going down.
Counting the mites.
Pretty much. And just as importantly, they'll assess how the skin itself is healing, less redness, hair regrowing, etc. Clinical improvement is crucial.
And long-term, what about prevention?
Well, the main preventative measure we already discussed is not breeding animals that have had the generalized form, especially juvenile onset, due to the likely hereditary component.
Right. Any potential complications during or after treatment?
The main one is those secondary bacterial skin infections, folliculitis or furunculasis that can develop. These often need separate treatment with antibiotics alongside the mite treatment.
Okay. And overall, what's the expected outcome? Prognosis.
For dogs, it really varies. It depends heavily on genetics, their immune status, and if there are any underlying diseases messing things up.
Right.
Like we said, localized Demodex in young dogs, usually a very good prognosis, often resolves on its own. But adult onset generalized Demodex, that can be much tougher, often requiring long-term management, and the prognosis might be more guarded depending on the underlying cause.
And for cats?
For cats, especially those with cati infections, the prognosis can sometimes be poor, not because of the mites themselves necessarily, but because of the serious underlying diseases often associated with it, like FIV or diabetes. The outlook for gatoi might be better if treated effectively and spread is controlled.
So wrapping this all up, it's clear Demodecosis is, well, pretty complex. Different forms, different mites, different implications for dogs versus cats.
Absolutely. I think the big takeaway is that while having some Demodex mites might be totally normal for many pets, seeing an overgrowth is a signal. It means something's out of balance, and it needs veterinary attention to figure out why and how to fix it.
And given all the variations, The different mites, the potential for hidden health issues, the specific medication considerations, the breed sensitivities. It seems absolutely essential to work closely with your vet.
Couldn't agree more. You need that accurate diagnosis first, and then a treatment plan tailored specifically to that individual pet and their situation. No cookie-cutter approach here.
Definitely. It really makes you think, doesn't it? Considering how things like genetics, immunity, maybe even stress seem to interact in these conditions. It leads to a broader question, I guess. What other, maybe more subtle factors could be influencing our pet's skin health that we don't always consider?
That's a great point.
It sort of prompts us to think a bit more holistically about their well-being, to be observant, keep learning, and see the bigger picture.